Today our topic is Picornaviridae. Picornaviridae they comes under the family Picornaviridae. That consists of a large number of very small RNA viruses, 27 to 30 nanometer in size. They are resistant to the lipid solvents like ether, chloroform, and bile salts. Classification: the four genera pathogenic to humans. One is enterovirus that infects the intestinal tract, rhinovirus that infects the nasal mucosa, hepatovirus that infects the hepatitis A, and the paracovirus. They causes the echovirus. Two more genera pathogenic for the animals. Aptovirus, this causes the foot and the mouth disease of cattle. Cardiovirus, this causes the encephalomyocarditis virus that infects the mice. While speaking about the serotype, the poliovirus, they have three types: type 1, type 2, and type 3. Virus, they have 24, 1 to 22, and the 24 one. Virus, the second part B is they have 1 to 6 serotype. Echovirus, they have 34. One is 1 to 9, 11 to 27, 29 to 31. The numbered interior virus 68 to 71. Poliovirus, the family Picornaviridae, genus enterovirus, species is Poliovirus. The virus is composed of an RNA genome and a protein capsule. The genome is single-stranded positive sense RNA genome that is all about 7,500 nucleotides long. Often they are called the simplest significant virus. This was first isolated in 1909 by Karl Landsteiner and Erwin Popper. Egyptian paintings depicted the effects of polio, shows a priest with the deformity of his leg, characteristics of the flaccid paralysis. This is the typical of the poliomyelitis. And the oldest known viruses, temple record from Egypt, 1400 BC. Morphology of poliovirus is, we can see the electron microscopy of the poliovirus here. Poliomyelitis, polio, this is a grey matter on the myelus, which is marrow or the spinal cord. Three types, poliovirus 1, 2, 3. They are ingested and spread by the alimentary route. They are commoner in the areas of the poor sanitation. While speaking about the morphology, special variant, they are spherical one, and also they have the symmetry with the icosahedral, 27 nanometer in diameter or in size. They composed of 60 subunits. They consist of 4 viral protein BP1, 2, 3, and 4. BP1 faces outside, major antigenic site for the combination. BP1 has type specific neutralizing antibodies. Viral genome, they are single stranded positive strand as ssRNA positive sense. Virus can be crystallized, seen in the cytoplasm of the infected cell. Poliomyelitis, this is the acute infectious disease which affects the CNS with the destruction of the motor neurons of the anterior horns in the spinal cord, resulting in the flaccid paralysis. However, most poliovirus infections are the subclinical. During the epidemic outbreaks, the type 1 is most frequently isolated in a 65 to 95% of cases, while type 2 and type 3 account for the remaining 5 to 35% of cases. Resistance. They are resistant to the lipid solvents like ether, chloroform, and bile, proteolytic enzymes of the intestinal contents, and the detergents. They are stable at the pH of 3. In feces, it can survive for 4 months at 4 degrees Celsius and for years at minus 20 degrees Celsius. Room temperature survival of virus in the feces vary, and it depends on the temperature, moisture, pH, and the amount of virus. They are readily inactivated by heat, 55 degrees Celsius into 30 minutes. Molar MgCl2, milk or the ice cream protects the virus against the heat inactivation. Resistance like formaldehyde and the oxidizing disinfectants destroys the virus. Chlorination destroys the virus in water. Organic matter present delays the inactivation of virus. Phenolic disinfectants are not effective one. They does not survive the lyophilization as well. Host range and the cultivation. Natural infection occurs only in the humans. Experimental transmission in the monkeys by the intracerebral or the intraspinal inoculation. Chimpanzees and the cynomolgus monkeys can be infected orally. They are established non-fresh strains. They can be grown in the rodents, chick embryos. The virus grows readily in the tissue culture of the primate origin. Primary monkey kidney culture. They are used for the diagnostic purpose and for the vaccination. While speaking about the pathogenicity, the virus they are transmitted by the fecal oral route through the ingestion. Other possible modes in the close contact in the patients of the early stages. Inhalation of the entry through the conjunctiva of the droplets of the respiratory secretions. This virus multiplies initially in the epithelial cells of the alimentary canal and in the lymphatic tissues, from the tonsils to the Peyer's patches. They spreads to the regional lymph nodes and enters the bloodstream, primary viremia. Further multiplication takes place in the reticuloendothelial system. Pathogenicity, the virus enters the bloodstream again. So now the virus is now carried to the central nervous system, spinal cord and the brain. In CNS, the virus multiplies in the selected neurons and destroys them. We can see the earliest change like degeneration of the nasal body. Lesions are mostly in the anterior horns of the spinal cord, causing the flaccid paralysis, but the posterior and the intermediate horns can also be involved. While speaking about the clinical features, they have the inapparent infection, minor illness, and the paralytic poliomyelitis or the major illness. Inapparent manifestations and the infection. 90 to 95% susceptible individuals develop only the inapparent polio infection with the seroconversion alone. Only 5 to 10% among them develop the clinical infection. Incubation period is nearly about 10 days on the average, and it ranges nearly 4 days to 4 weeks. Minor illness. Early manifestation is fever, headache, sore throat, and the malaise. The phase of the primary viremia. The incubation period will last up to 1 to 5 days, called the minor illness or the abortive poliomyelitis. Paralytic poliomyelitis or the major illness. Progression of infection is nearly 3 to 4 days after the minor illness. They results in the major illness. Fever returns, the biphasic fever, along with the headache, stiff neck, and other features of the meningitis due to the viral invasion of the CNS. This is the polio case. Non-paralytic polio. The disease that does not progress beyond the stage of the aseptic meningitis. So, types of polio will be the non-paralytic polio and the paralytic polio. Paralytic polio can be further divided into spinal polio, bulbar polio, and the bulbospinal polio based on the distribution of paralysis. Here we can look for the complication is like post-polio syndrome. They may also occur in which the symptoms ranging from breathing and the swelling problem to the joint pain. They start many decades after the initial sickness. The asymptomatic is nearly 95%, stiff neck can occur 2%, paralysis less than 1%, and the minor symptoms will be occurring like a 2% in the polio. Laboratory diagnosis like the samples to be collected like blood, CSF, throat swab and the feces. Transport is nearly immediately to the lab in the viral transport media. Storage 4 degrees Celsius for the race and the 20 degrees Celsius if it is months to years. Laboratory diagnostic testing available like viral isolation, serodiagnosis and the molecular diagnosis. Viral isolation in the tissue culture during the primary viremia 3 to 5 days after infection from the blood. Early stages like the isolation from the throat strap. First week of infection is nearly 80 to 85% viral isolation from the feces. Second week of infection is nearly 50% of the viral isolation from the feces. Third week of infection is nearly 25% of the viral isolation from the feces. The fecal excretion is likely the intermittent, so the 2 samples needed to be tested here. Prolonged fecal excretion in the immunocompromised, but no permanent carriers will be available. So the poliovirus isolated from the CSF, but it can be isolated from the spinal cord and the brain. Postmortem diagnosis like interior viruses. Primary monkey kidney cells are employed commonly. Human or the remaining kidney cells are also be used in the viral isolation. Inference: viral growth indicated by the cytopathic effector CPE in 2 to 3 days. Mere isolation does not confirm the diagnosis. And the next step is the serodiagnosis. Antibody rise appears after the onset of paralysis. These are demonstrated by the neutralization test or the complement fixation test. CFT is useful to identify the exposure to the poliovirus but not for the type specific diagnosis. And last one is the molecular diagnosis, that is reverse transcriptase PCR. Viral RNA in the CSF is demonstrated. RNA sequencing. In circulation, 3 types of strains is circulated. One is wild virus, OPV strain, oral poliovirus, and the VDPV vaccine derived poliovirus. Immunoprophylaxis. Salk vaccine. These are developed by Salk in 1953, formalin inactivated by vaccine. These are given intramuscular or the subcutaneous one. 3 doses given 4 to 6 weeks apart, followed by the booster given. And 6 months later, the first dose given after the 6 months, booster given every 3 to 5 years one. And the next vaccine is the Sabin vaccine. This was developed by Sabin in 1962. Type 127R are grown in the monkey kidney cells. Shelf life of vaccine is 4 to 6 months at 4 to 8 degrees Celsius and 2 years at minus 20 degrees Celsius. Vaccine should not be neurovirulent. Should induce an immune response locally. Live attenuated strain contains the type 1 virus 10 lakh units and the type 2 virus 2 lakh units and type 3 3 lakh units. This stimulates the local IgA and the humoral IgM and IgG. Virus excreted in the feces, so protects the community. They are given orally. 3 doses are given. 0 dose is given at birth. First dose at 6 weeks and the second and the third dose at the different of 6 weeks. Booster is given at 18 to 24 months of age. Eradication of the poliomyelitis. The World Health Organization in 1988 proposed the global eradication of the poliomyelitis by the year 2000. By global immunization with the OPV, poor progress in the immunization in the many countries has been set back to this objective. In 2015, only 75 cases in the entire world. In India, in 2009, there will be 749 cases. So, at present, Pakistan, Afghanistan and Nigeria is still holding the poliomyelitis virus. Pulse polio immunization program, the mass administration of the OPV on a single day to all children aged 0 to 5 years in the community. The strategy is to give the rounds of doses at an interval of 4 to 6 weeks during the low polio transmission period in the winter. It is November to February. Treatment. Currently, there is no treatment to cure the polio. Treatment is focused on the supportive care like moderate exercise and the nutritious diet. The medication adjusts to lower the fever and to reduce the pain and improve the strength. Breathing assistance with the ventilator. To prevent the poliovirus, the most effective and the most commonly used is a polio vaccine. This vaccine is given to the young children in the specific increment. Vaccine works by the strengthening and preparing the immune system to the future encounter with the poliovirus. Coxsackie virus. These are isolated in the 1949 from the Coxsackie village of New York resembles the poliovirus. They are 2 types. Coxsackie A. This causes the myositis and the flaccid paralysis. Coxsackie B. This produces the patchy myositis, spastic paralysis, pancreatitis, hepatitis and the myocarditis. Clinical features like infection transmitted by the fecal oral route. Incubation period is nearly 2 to 9 days. Group A virus. This causes the aseptic meningitis, vesicular pharyngitis, headache, fever, pharyngitis, pain, abdomen, and the hand, foot, mouth disease, which will be a vesicles in the mouth, hands, and feet. Next type is Group B virus. This will be a born home disease like epidemic myalgia, myocarditis, pericarditis, aseptic meningitis, juvenile diabetes, neonatal infections, post-viral fatigue syndrome. Lab diagnosis. The specimen will be the feces. They are inoculated in the suckling mouse and the histopathology done, followed by the neutralization test. Tissue culture done. This shows the cytopathic effect. Serology will not be effective. Vaccination is not effective here. Echovirus. Anterior cytopathic human orphan virus. This infect only the human. They resemble a poliovirus. They spread by the fecal oral route and they remain in the GIT. Clinical features like aseptic meningitis, paralysis, rash and fever. They also have the diarrhea, respiratory disease, pericarditis and the myocarditis. Enterovirus. They are similar to the poliovirus, causes the pneumonia, acute hemorrhagic conjunctivitis, meningitis and the encephalitis. Acute hemorrhagic conjunctivitis IP 24 hours causes the swelling and the congestion, watering and the pain in the eyes, subconjunctival hemorrhage. Recovery occurs in 3 to 7 days. Rhinovirus. This causes a common cold, isolated from nose and throat, acid labeled, so no GIT symptoms. Optimal temperature for the growth is 33 degrees Celsius. Virus resembles the other Picornaviridae except that it is destroyed in the acid pH. Virus causes the common cold infection transmitted by the droplet infection. IP, that is the incubation period, is nearly 2 to 4 days. The patient have the watery nose, sneezing, cough, headache, sore throat and the malaise symptoms resolve in the 7 days. Lab diagnosis like the specimen is collected from the nose and the pharyngeal swab. The specimen inoculated on the human and the monkey cell lines and incubated at 33 degrees Celsius. The virus antigen is seen by the ELISA and the PCR test. Serology is not useful here. Poliovirus. Let us see the summary of a poliovirus. They belong to the enterovirus, ssRNA virus plus SINS. Poliovirus is nearly 3 types, type 1, 2, 3. They are fecal oral administration. Paralytic or the non-paralytic polio will be the 2 types. The specimen is collected like CSF, blood, throat swab and feces. Neutralization test is ELISA, CFT, RT-PCR, OPV, IPV, SALC and the SABIC. These are the vaccine. Pulse polio immunization program is done for the poliovirus. Thank you.